Rena, would you like to ask a question, and where are you from?
Yes, hi. From New York, Dr. Bredesen. You mentioned herpes simplex. I know someone very close to me that has it, but they're taking acyclovir every day and may get an outbreak maybe once every 2 years. Is that person's risk for Alzheimer the same? And also, do you believe in eating meat as part of your fat in your diet?
Yeah, good points. So herpes and fat, meat. So first of all, there was a wonderful study out of Taiwan showing that people who at midlife were treating their herpes outbreaks on their lip, and I should say HSV1, but also HHV6A is another one that they found in the brain, which is a different type of herpes. But the people who are treating their outbreaks had a dramatically lower level of developing dementia. It was more than 50% reduction. So I really believe in that. Now, the person you're talking about, it sounds like they're treating it, which is great, and they're suppressing it most of the time. So they are likely to be reducing their risk, again, based on the Taiwan study, which was an excellent study. With respect to meat, yes, this is part of, so the diet that we use is called Ketoflex 12-3. As I mentioned earlier, you can now get it from Nutrition for Longevity. They'll deliver it to you. I've eaten it. I've had what they made. I was very impressed with what they were able to do. This is the group that was started by Walter Longo and his colleagues. And I think they've done some very nice work. So yes, absolutely. And you know, when I say meat, I'm talking about wild caught fish, not farm fish, you know, wild caught seafood. I'm talking about some grass-fed beef, fine. And I'm talking about some pastured chicken, not, you know, horrible chicken, not, you know, bad beef that's not grass, all of these sorts of things that can actually be quite toxic. So I'm talking about the ones that are actually, you know, in general good for you. Now, I recognize there's a huge ongoing issue. We have people who are completely 100% carnivorous and are, you know, want to have all the various organs, et cetera. And we have people that are completely 100% vegan, and then we have everything in between. We're simply looking at what has given the best outcomes for cognitive decline. And it is the Ketoflex 12-3 approach. The issue I have with some of these others, like Mediterranean diet, that's fine, except that they don't get you into ketosis. And ketosis is one of the more important things to be able to supply your neurons and your synapses. So yes, absolutely. You don't want to, for that diet, you know, it's a plant-rich, mildly ketogenic diet. So you don't want to be making the plate, you know, mostly meat. I'm sure you've seen the pictures, and we've got pictures of Ketoflex 12-3. You've got a little piece of fish or chicken or beef, and then you've got a lot of salad and vegetables. That's kind of the way it should look.
Okay.
Thank you.
Rochelle, would you like to ask a question, and where are you from?
Yes. Hi, Stephen. I'm from Long Beach, New York, and my name is Rochelle. My question is, my dad had dementia, and I was always wondering, he had a very poor diet. He drank a lot of coffee and put sweet and low in it. You know, he's a very stubborn man. I couldn't change his diet, junk food diet. I'm wondering if that accelerated his dementia. And my other question is also on the vaccination for COVID, if there's any connection to getting dementia or Alzheimer's.
Yeah, great points, both. And no question, poor diets accelerate your risk for dementia and can accelerate your dementia, especially high sugar, high carbohydrate, pro-inflammatory diets that produce insulin resistance. So no question. And this is why getting, the right nutrition is part of those 7 basics that I mentioned earlier. And then with respect to COVID, yeah, this is such an important point because, as you know, there, again, huge controversy. Should you have vaccination? Should you not have vaccination? Well, I wish people would quit thinking that it's 100% zero. It's black and white. It's not black and white. One is better for the society as a whole. You decrease the risk. On the other hand, no question, there are people who have had issues when they've gotten vaccinated with things like myocarditis. You can't deny that. There are people who've had, from the J&J one, of course, superior sagittal sinus thrombosis and died from it. So there's no perfect answer here, but anything that is triggering ongoing inflammation, and that includes boosters, includes exposures to these various toxins and things, it includes various infections, will increase your risk for developing Alzheimer's disease.
Okay, thank you. Let me just throw one quick thing in. I just once heard this from David Wolf, that people on lower floors, like if you're standing on your basement versus standing on the 18th floor of a building, that somehow there's some kind of benefit. Does that resonate with you in any way?
Well, so what's been published is actually the carbon dioxide in where you work. So what they are showing is it's really about how good is the ventilation. The ventilation, as it goes down and your carbon dioxide goes up, they show very nicely that your cognition slows. So for all of us, we want to be in places that have good ventilation. And it's been surprising how bad the ventilation can be, and people won't really think that they notice it, but they are functioning less well. Now, as far as being on lower floors, something unrelated to that, I don't know. I don't know these data. I haven't seen this paper. So maybe you could give more details. What was it about being on lower floors?
I don't have enough information. I don't remember.
Yeah.
Okay. Lori, would you like to ask a question? And where are you from? Lori?
Yes, I'm from New Jersey, and I would like to maybe try to ask a question.
Sure.
It's a little different, but maybe you would know because Michael had said a little bit about this cranial sacral sort of thing. Unfortunately, I know a relative that during the pandemic, unfortunately, was diagnosed with something rare called Chiari. Unfortunately, there was a syrinx too, so the cerebral spinal fluid was not moving. Had neurosurgery, and because of what's going in New York, I was afraid to go in there. But anyway, I wondered if there's anything that either Dr. Bredesen or Michael knows about helping that problem with some kind of cranial help.
I think you're mentioning Chiari malformation, which is kind of a contraindication, but we can treat in a very gentle way. And there's different stages of it. Some are more severe. It's kind of like where the brainstem flows down in the foramen magnum, and it can cause a problem if it slips below that aperture.
Yes.
So there's a way that if someone's advanced, can treat it in a very gentle way, but we have to be very aggressive, very careful about that and not be too aggressive when we're treating. But it's something to look at to see if we can address it structurally as well, because certainly in their case, that may have exacerbated their problems as well. Certainly when you have lower flow of cerebral spinal fluid, which is something we've looked at quite a bit, that's not a good thing, obviously. You want more flow. So,
Exactly.
yeah.
Exactly. Yes. And Dr. Bredesen, do you know anything about that problem?
Yeah, I mean, Arnold Chiari is a relatively well known, and there are neurosurgical approaches to it as well. And as you mentioned, it can be associated with syringomyelia.
Right.
So I might hope this person has seen both a craniosacral person and also a neurosurgeon to get multiple opinions to see what's going to be the best way to treat this.
Well, the surgery was done with a neurosurgeon, but we kind of left up in the air as to what to do after that. And so
Okay.
it's been quite frustrating. So,
I'm sorry to hear that.
I don't know. Yeah. And unfortunately, when she was young, she had chronic ear infections. So I have to live with that. I was told to give her colimycin, which is ototoxic. So she does sign language now too. It's just that it's hard.
Right.
And I don't know if you know of anybody in the New Jersey area or that might be able to help.
I don't know any specialists on this particular area in New Jersey. No, I'm out here in California, so I don't know too many doctors in New Jersey.
I see. Okay. I know.
Even
that-
if you want to put me in touch with her later, I can give her some referrals for some cranial people in New Jersey if she likes.
Okay, Lori, you can email us at info@realtruthtalks.com, and we'll put you in touch with Michael Morgan, okay?
Okay, info at Real Truths.
Info@realtruthtalks.com, or just go to our website to contact, and just say that you called in during the conference and would like to get in touch with Michael Morgan.
Okay, I certainly appreciate you're reaching out that way, and I'm enjoying all the lectures too, learning so much. Thank you.
Thank you. Elizabeth, would you like to ask a question, or where are you from?
Yes, Elizabeth Stumpf from Quebec, Canada. I'm a family physician, actually. So I had a few questions. I'll ask two, and if you have time, maybe I can ask two more to go back in line. So first one, I was wondering if lecithin was a good choline supplement or good for choline supplement. And the second one is for a person who has a normal MoCA score of 30, and you want it to have a better sensitive evaluation with the CNS vital signs. Can that be done online actually by the person, or do you have to order the test, or does the physician has to pay a fee for that? How does it work? Because I looked online and it wasn't clear for me how to use it.
Yeah, good point. So first of all, lecithin's excellent. Yeah, it's one. Just be careful about the total amount of choline you're getting in the lecithin. And as far as CNS vital signs, yes, it's typically ordered by the physician. But there are all sorts of, you don't even have to do that one. If you don't, want to do that, there's Brain Check, there's Cambridge Neuroscience. There are all sorts of ways to go. There's also the SLUMS, St. Louis, all that. St. Louis University one, but although that's very similar to MoCA. Great to hear that you have a score of 30 on your MoCA. That's excellent. But you're absolutely right. It's helpful to have more sensitive ones. One thing I would recommend, the easiest one of all probably, have you done CQ test? Just look up a CQ, so C and a little Q, CQ test. And was it designed? It's a free online test. It was designed by Alan Boyd, who designed the CNS vital signs, but you don't have to worry about anyone ordering it. You just do it freely online, and it will give you a percentile for your age, so you can see where you stand. And it's much more sensitive than MoCA.
Okay, Michael, how do people stay in touch with you, follow up with you, get access to your book, to your work? What's the best way to do that?
If they want to email me, they can email me at michael.morgan@preventingalzheimers.com. So that's one way we can give them a referral.
Okay, and I think if you go to our website and you go to speaker bios and you click on Michael Morgan, you will see that gives you access to this book is under the bookstore. Let me just look. If we click under your name, I just want to make sure it goes to the right source for your information. So let's see, Michael Morgan. So it goes to preventingalzheimers.com.
Right. That's the website as well. Yeah.
Okay. And that's the best way to follow up with you?
Yes. Yes.
Okay. And Dr. Bredesen, if people want to learn the Bredesen protocol, your programs, your books, what's the very best way for people that want to follow up with you and get more information and learn more?
Yeah, drbredesen.com. You can do that. You can go to mycognoscopy.com. And again, I encourage everyone, get a cognoscopy, see where you stand. It's relatively easy to do. And let's make sure that you don't have to worry. The reality is that, my generation, I'm an old guy, but my generation should be the last one to worry about Alzheimer's disease. And everyone who's, in their 20s, 30s, 40s, 50s, and even 60s should not have to worry about this. Get on active prevention. Don't wait. You can also get the books. So The End of Alzheimer's Program, and The First Survivors of Alzheimer's. All books that talk about the approach that we take. And you can also take training. And that's called Recode 2.0 training for anyone who's interested in training this. And it's about 35 hours or so online training.
So the Recode protocol?
Yes. This is for the training, it's Recode 2.0.
Uh-huh. So if someone wants to, they go to our website, they click on your name, we go to the website, and I see something that says Apollo Health Reversal and Brain Optimization Recode Program. Enroll now. That's not the training, that's to actually learn the techniques or
So I'm not sure which page you're looking at, but there are pages there specifically for getting on a program yourself. And there are pages there for training, and it's pretty clear on there which one's for training and which one's for. So, yeah, so I'd have to look and see which one you're looking at right now.
Okay, and then this one, it says that there's a recode program and you can get lab tests with it. And this is a way that you would work, or your team would work closely with people and help them?
Exactly. Yeah. And as I said, we've trained over 2,000 physicians from 10 different countries and all over the US. So there should be someone near you that we have trained. And you can get, with their team, with the physician, the health coaches they have, et cetera. And you can actually get the blood testing before you even go in. So you can get the blood testing on your own online. It's pretty simple to do. And it will do the various tests that your doctor is typically not doing. So it will look at the critical ones to tell you whether you're at high risk or low risk.
Okay, can we unmute everyone? I really want to thank both of you. This information is invaluable, a little scary, but invaluable. And I appreciate you giving a positive slant and giving us all hope about a subject that has been we've considered, a terrible sentence if you get it. So it's very great.
Thank you.
Thank you very much.
Thank you.
Thank you so much.